Hi, Mary Ellen. I'm Dr. Mcilwain. Nice to see you today. Today, I'm Mark Mcilwain, and I'm going to talk to you about the process of informed consent. Informed consent isn't a piece of paper. It's a process you go through with the patient to make them understand what you're going to be doing for them and get their permission to do it while they understand the risk, benefits, alternatives, and you answer any questions. So let's get started. One of the first things I would do was examine the patient carefully. And once I've examined the patient, then I would refer to their radiograph as the patient and I have a conversation. And if you'll notice on this radiograph, I've carefully marked the wisdom teeth in each area, and I've also marked the pertinent anatomical structures, the sinus above and the nerve below. And that's so that I can demonstrate to my patient carefully, even using a skull if necessary, so that they understand exactly what I'm talking about in layman's terms. So the first thing would be I would look over their medical history, and I would see things in their medical history that I would ask them questions about, and we would have a dialogue until I was certain of their medical history. Then my nurse would have already performed the procedure where she comes in and develops the medical history. Then I would go over it, and I might ask some questions. For instance, you had a staph infection. Did you have problems with that? The staph infection, did you have to take antibiotics for a prolonged period of time? Did you use back-to-band ointment in your nose to eradicate the staph infection for a month? And we would have a conversation so that I would know their medical history. Then once I had established that, and I'd established if they were not allergic, how much they weigh, what classification they are an ASA1 healthy, ASA2 with one medical problem, a 3 with multiple medical problems, or a 4 that's very ill, we would know that and record that in the chart. So what I'm going to do now is begin the discussion of informed consent with the patient. I'm going to point out to them some things that are very important, and I'm going to give you the opportunity to see how I do it. If you look on this x-ray, you can see, Mary Ellen, that you have 2 upper wisdom teeth. Those upper wisdom teeth sit with their roots at the edge of the sinus. When we take out upper wisdom teeth, we can open a small hole to the sinus. Most times we open a hole to the sinus, it will seal on its own. 1 out of 1,000 doesn't seal. If it doesn't seal and you take a big drink of Pepsi, milk, or Mountain Dew and it drips out your nose, then we may have to repair that hole if it doesn't heal spontaneously. Again, that's only a 1 out of 1,000 risk. Now the lower wisdom teeth sit just beside the little nerves that give you feeling in the lip, chin, and tongue. And when we take those wisdom teeth out, we can bruise that nerve. If we bruise the nerve, you can have some temporary numbness in lip, chin, or tongue that can last 6 weeks to 6 months, 3.5% of the time. The risk of any permanent numbness from taking out a wisdom tooth at your age, and that's loss of sensation, not paralysis, is less than 1%. Now, if you leave these wisdom teeth and you are no longer 17 or 18 as you are now, and you become 40 years old, the risk of taking out those wisdom teeth goes up. It's about a 5 to 7.5% risk when you're at that age for having a permanent nerve injury in lip, chin, or tongue. And I think that that's something that's important, and that's a good reason to get these wisdom teeth out while your teeth are pretty and straight and before they can damage the roots of the adjacent teeth or entangle with the nerves. Now, let's talk a little bit about what we'll want you to do. And I'd like you to read this form when you get home, and it's information for patients considering oral surgery, and it's basically what I'm going to tell you now. This is a pre-op form that you'll also look at that tells you the several important things. There's 7 things on here that you should do before surgery to be sure that your surgery goes well. Follow these instructions completely without deviation. If you have any questions, call the office. Our phone is answered 24 hours a day, 7 days a week, and the doctor on call can help you. Now, you won't eat or drink anything for 6 hours before you come. You'll bring someone responsible that's an adult to drive you home and care for you for 24 hours. Once you get here, you'll have taken your little nerve pill ahead of time, and we'll start a little IV for you and give you medicines through the IV that'll help you be sleepy. You'll doze off, and when you awake, you'll be biting on a gauze pack. You bite hard on that gauze pack for at least 1 hour. No forceful rinse and spit and sucking through a straw for the rest of that day. 3 or 4 days later, everyone gets the chipmunk cheek and swells up. So ice packs are very helpful on the face for the first 3 days after surgery. That's post-op day 1, 2, 3. Post-op day 4, you'll take a heating pad. Heat and massage over anywhere you're sore and swollen 5 minutes at a time, 3 or 4 times a day, will help your swelling and soreness to start going away over the next several days. Lots of good warm saltwater rinses starting the day before surgery, and then continuing the day after surgery will help you have a clean mouth. A half a teaspoon of salt and a cup of warm water, and rinse 3 or 4 times a day. Some Advil or Aleve or ibuprofen started ahead of time and taken along with your other medications will cut your soreness and swelling in half if you can tolerate it. I've got you a little nerve pill, and you take that little nerve pill the night before surgery so you rest well, and you can take it 2 hours before your surgery, the second pill, and you won't really care about coming here, and you won't be worried, and you wouldn't care if we started an IV or didn't start an IV or whatever we do, so it'll just make anxiety not be a problem. Do you understand the things I've told you? Do you have any questions? Okay, well, let's make sure you've got the proper paperwork. You've got the pre-op instructions. You've got the information for oral surgery, and this is your consent form. And your consent form just puts down on paper the things that I've told you, and these will be, each one of these things you'll go through and look at, and we'll put in what your diagnosis, and you have some sore wisdom teeth, and the surgical procedure will be surgical removal of your wisdom teeth, 1, 16, 17, and 32, and that's the numbers of each of the wisdom teeth under IV anesthesia. And it'll just say that we've told you not to eat or drink, and it'll remind you to follow the instructions very carefully and to call us with any deviation from the instructions. You will sign, and your parent will sign, and I will sign, and my nurse will sign, just saying that we've all talked about this, and then we'll give you the papers. All right. If there was something that was out of the ordinary that I needed to talk to her medical doctor about, I would memorialize that in a short note to the medical doctor, and then I would fax this to the medical doctor so that we would have a permanent record in the chart. Once this discussion is complete, I again ask them, and then I have a member of my surgical staff, a surgical assistant, or a registered nurse come in and talk to them again, basically going over everything again, and then once again memorializing it in the chart. So everything is written down in the chart, so there's no doubt about it. We use a lot of check boxes, we use a lot of redundancy, and that's because we've got to be safe. And you see, informed consent, therefore, is a process. It's not a piece of paper. This is Mark Mcilwain asking for your vote for the dental board in the state of Alabama. That election is September 1 till October 1, and I'm a wet finger practicing dentist who cares about dentistry in Alabama. Please vote for me. Thank you.